Good afternoon. We'll continue our subject. As well known, a negative feedback control system is responsible for thyroid hormone synthesis and secretions. TSH, 3T4, and the 3T3 are interrelated through the operation of the hypothalamic pituitary feedback regulations. TRH, or thyrotropin releasing hormone, is released by the hypothalamus and stimulates the anterior pituitary to secrete TSH. TSH, or thyroid stimulating hormone, then acts on the thyroid gland to stimulate the synthesis and the release of 3T3 and the 3T4, which act negatively on the anterior pituitary gland to suppress the release of TSH, thereby controlling the thyroid hormone productions. It's very clear that TSH levels are opposite the thyroid hormone levels. Therefore, if the blood thyroid hormone levels are low, the TSH will be elevated and vice versa. As clear here. When the free thyroid hormones are low, TSH increases and vice versa. This means there's inverse relationship between TSH and the thyroid hormone. In functional hormonal disorders, if the thyroid hormones and TSH concentrations in the blood are changing in the opposite direction, that's to say, as the thyroid hormones decrease, the TSH increase, or as the thyroid hormones increase, TSH decrease, then the starting pathology is in the thyroid gland. That says the thyroid gland is the cause of the disease and TSH change are effect. This is called the primary thyroid disease, which refers to problems arising from the thyroid gland itself. On the other hand, if both TSH and thyroid hormone concentrations in the blood are changing in the same direction, let's say both increase or both decrease, then the starting pathology is in the TSH, let's say in the pituitary gland or hypothalamus. Pituitary gland is the cause and thyroid hormone changes are effect. This is called secondary thyroid disease, which refers to a problem arising from the anterior pituitary gland, and these are rare, very rare causes of thyroid hormone disorders. This figure shows the relationship between TSH on the y-axis and 3T4 or free thyroid hormone on the x-axis. As clear, the relationship is inverse. Imagine this point. At this point, the free thyroid hormone concentration, this is a free thyroid hormone. At this point, free thyroid hormone concentration is very high, whereas the TSH concentration is very low. If you go to this point, at this point, the free T4 is very low and TSH is very high. So the relationship is very clear that it's inverse. But also, it's not linear relationship. It's log linear or logarithmic relationship. So one-fold change in the free thyroid hormone in one direction results in 10-fold change in the TSH in the opposite direction. Two-fold change in free thyroid hormone in one direction results in 100-fold change in TSH in the opposite direction. This is the inverse, this is the logarithmic relationship. A two-fold decrease in 3T4 results in 100-fold increase in TSH. A two-fold increase in 3T4 results in 100-fold decrease in TSH. Here, this is a working example. This is a reference range for 3T4 from 0.7 to 1.9, and the reference interval for TSH is from 0.4 to 4.5. A change of 3T4 from 1.2 is normal, to 0.6, this is a two-fold change from 1.2 to 0.6. This will result in a TSH rise from 0.5 to 50 microinternational per milli. This means a 100-fold change. Again, from 1.2 to 0.6, this is a two-fold change in free T4. This will result in 100-fold change in TSH. On the other hand, rise in TSH from 0.45 to 4.5 reflects a drop in 3T4 from 1 nanogram per deciliter to just 0.9 nanogram per deciliter. That's why, in the absence of hypothalamic pituitary disease, TSH is extremely sensitive, as very small changes in free thyroid hormone results in a relatively very large changes in serum TSH. Serum TSH concentration increase in mild thyroid failure, where 33 and 34 concentration are still within the reference interval. This is called subclinical hypothyroidism. And also, TSH decrease in mild thyroid hyperfunction, where 33 and 34 concentration are still within the reference interval. However, again, for reliable interpretation of thyroid function tests, an intact hypothalamic pituitary thyroid axis is needed. That is to say, the assumption that TSH is extremely sensitive test and it's inversely related to thyroid hormone in a logarithmic manner. This assumption is based on the fact that hypothalamic pituitary axis should be intact. Thyroid disease can be broadly categorized as structural disease, goitre, nodules, cancer, or functional disorders, hypo and hyperthyroidism, which are further classified into primary, the defect in the thyroid gland. This is the most common cause. This is more than 99% of the causes of thyroid hormonal dysfunction. And secondary, thyroid disease, in which is a defect in the pituitary. This is less than 1% of the case, even less than 0.01% of the causes. Then hypothyroidism and hyperthyroidism are further classified into overt, in which the T3 and the T4 are abnormal, or subclinical, in which free T3 and the free T4 are normal.